Welcome back to the Medigap Show. I'm your host, Holly Cohen, founder of MedigapCares.org, where you can book a free consultation with either me or a licensed member of my team to help you understand Medicare and all of your options. Today, we have a very important topic to discuss related to the benefits of original Medicare and Medicare supplement plans, in contrast to Medicare Advantage PPO plans. Original Medicare combined with a Medigap plan is better health insurance due to federal laws that prioritize patient care and coverage. To shed light on this, we're going to refer to an enlightening article titled, Your Medicare Advantage PPO Plan Can Stick It To You, written by Diane Amdahl and published on Forbes.com. Medicare Advantage Preferred Provider Organization or PPO plans give members the flexibility to choose physicians so that they have coverage wherever they go in the United States or its territories. Even though non-contracted physicians don't have to see every member except in emergencies, and out-of-network services can cost more, PPO plans are a popular option, making up over 40% of plans. As with just about every Medicare Advantage plan, PPO plans can require prior authorization, a process through which physician or other healthcare providers must obtain approval from the plan in advance of any recommended procedure. You don't need prior authorization when you receive services from an out-of-network provider. Given that 99% of Medicare Advantage members are in plans that require authorization, this could be an amazing benefit. But is it really? Remember the old adage, if something seems too good to be true, it probably is. I researched the evidence of coverage documents from 4 of the biggest Medicare Advantage companies. I found this paragraph almost word for word in all of them. Here's the paragraph. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, you may want to ask for a pre-visit coverage decision to confirm that the services you're getting are covered and are medically necessary. This is important because without a pre-visit coverage decision, if we later determine that the services are not covered or were not medically necessary, we may deny coverage, and you will be responsible for the entire cost. PPO plan members need to understand the significance of those 85 words, or they could end up with some very big medical bills. Here are the important points. There are no prior authorization requirements for out-of-network services, given that physicians and their staff spend on average 14 hours each week completing prior authorizations or PAs. They'll be relieved not to do another. Even though there is no requirement, the plan says you may want to ask for a pre-visit coverage decision. Without that decision, the plan can later determine that the services were not covered or medically necessary. In that case, the plan will deny the care and you will get the bill. So it may be best for you to change a few words in one sentence in that paragraph. However, before getting services from out-of-network providers, you should ask for a pre-visit coverage decision to confirm that the services you are getting are covered and are medically necessary. That may not be the easiest thing to do. The evidence of coverage does not provide any details about this decision or how to go about asking for one. The results of an internet search of pre-visit coverage decision focused on pre-coverage determinations for healthcare providers. Tips to avoid retroactive denials. Whenever possible, get necessary medical care from an in-network provider. Prior authorization is generally the provider's responsibility. Examine your plan's evidence of coverage for information about prior authorization for out-of-network services. Check the member's resources on your plan's website for any information regarding authorization of out-of-network care. I only found information about providers submitting authorization requests and the authorization forms for personal representatives and the like. Ask a plan representative about a pre-visit coverage decision if you're about to receive services from an out-of-network provider. Find out what information you need, your physician or provider's role in this process, how to submit it, how the plan will communicate that the services are covered and medically necessary, the time frame, how soon before the services are provided, and how long it will take to make the coverage decision, and your options, including filing an appeal. If the plan determines it won't cover the care, many Medicare beneficiaries love their PPO, Medicare Advantage plans. But remember, there are two ways the plan can stick it to you if you're seeing out-of-network providers. Number one, the services can cost more. Number two, you can end up with a bill. Pay attention and be proactive in determining what you need to do. Are you considering a Medicare Advantage PPO plan? While these plans can offer certain advantages, it's crucial to be aware of potential pitfalls that may leave you with unexpected out-of-pocket costs. Medicare Advantage PPO plans typically have a network of preferred providers. If you receive care from a non-preferred provider, you may be subject to higher costs or limited coverage. Diane Omdahl's article sheds light on the potential pitfalls of a Medicare Advantage PPO plan and highlights the importance of being aware of the associated challenges. However, when it comes to original Medicare combined with a Medigap plan, the landscape is significantly different. With original Medicare, there are no preferred provider networks. This means that you have freedom to choose any healthcare provider who accepts your red, white, and blue Medicare card. Whether it's your trusted primary care physician or a specialist, as long as they accept your red, white, and blue Medicare card, they are required by federal law to provide you with coverage and direct bill to Medicare, and anything that your doctor deems as medically necessary, original Medicare must cover it at 80%, and then your Medigap plan will pay the 20%. If you have a Plan F, it will pay every deductible in both Part A and Part B. If you have a Medigap Plan G, it will pay all deductibles and all coinsurance in Part A, and it will also pay all coinsurance in Part B, and you're only responsible for the $226 annual deductible of Medicare this year. This gives you flexibility to seek care from the providers that you know and trust without worrying about network restrictions or incurring higher costs. Another key advantage of original Medicare and a Medigap plan is the absence of prior authorization requirements. So we've discussed the key highlights of this article and explored how original Medicare combined with the Medigap plan offers a stark contrast to Medicare Advantage plans. With original Medicare and a Medigap plan, there are no preferred provider networks, no prior authorization requirements, and no network restrictions. These federal laws are protected only when you're on original Medicare, not when you're on a Medicare Advantage plan. And these federal laws ensure that if your doctor deems a medical service as medically necessary, you will not be denied coverage or face unnecessary administrative battles. If you have any further questions or need assistance in understanding the benefits of original Medicare and Medigap plans and your Part D plans, please don't hesitate to reach out to me or a licensed member of my team at medigapcares.org. Stay tuned for more information on Medigap Show, where I strive to provide you with the knowledge that you need to make informed decisions about your Medicare coverage. Thank you for joining me today. If you like the video, please hit the like button and be sure to subscribe to the channel so that you're informed on all things new and relevant to your Medicare, whether you're new or you have been on it for a while. That's all for today. This is Holly Cohen of Medigap Show. Take care and be well.